Hi, my name is Deanna Shavlowski, and I'm from Coding and Reimbursement. I'm going to be speaking to you about Medicare wellness visits. Medicare will cover an annual wellness visit, AWV, once every 365 days. Unlike a preventative visit, which is more hands-on and includes a physical exam, the wellness visit focus is based on a list of specific questions and tools to assess the patient's medical status. AWV stands for A, Annual Health Status Review, W, Wellness Planning, and V, Counseling Visit. Older adults who obtain clinical preventative services and practice healthy behaviors are more likely to remain healthy and functionally independent. Right now I am looking at the intake note. Most of an AWV is documented by the nurse. Any documentation done as part of a nurse intake will pull into the AWV templates. First, make sure you pick the correct specialty and visit type, which will be the Medicare preventative. To assure these visits are documented correctly, under Reason for Visit, click on Additional Manage and choose Medicare Preventative as the visit type. This will pull up all the necessary templates needed to document the visit. You will then want to double-click on Medicare Preventative. At this point, you will want to select the type of annual wellness visit this is. It's either going to be a Welcome to Medicare, IPPE, which is done during the first 12 months of a patient's Medicare coverage, or an initial AWV, annual wellness visit, which is done after the first 12 months of their Medicare coverage. If they have had an AWV in the past, you will want to hit Subsequent Annual Wellness Visit. Review and update the advanced directives, and make sure it is dated. Save and close. Next, you're going to want to click on History Summary. Review and update the patient's past medical, family, and social histories. Be sure to click on Detailed Document for all three and save and close. And that will assure it pulls into the Master IM. Next, you'll want to input your data into the vital signs, making sure that height, weight, and blood pressure and the vision screening is completed. Always make sure to unclick the Submit Vision Screening to Superbill, as it is not separately billable. Also, all three needs to be completed, OD, OS, and OU. Save and close. The next is depression screening. There are two questions. If the answer is yes, you will then need to click on depression screening and complete the template. The cognitive assessment does not have to be completed. Instead, the nurse needs to complete the review of systems. I will show you that in a little bit. Next, you can click on Functional Ability Safety Home Environment. And be sure to complete all the questions, making sure you also include the fall risk plan. Nutrition is the next one. Be sure to complete and include the BMI. If the patient is obese, click on Details if patient is counseled on obesity. Tobacco, vaping, and alcohol is the next slide. Again, making sure you complete all the questions. And then this is where the review of systems come into play. There are only two that are the most important. Sometimes the nurse may not be doing this, but please make sure that the provider does. Under HEENT, please select negative or positive for hearing loss. And under neuro and psychiatric, please click negative or positive for memory impairment. There is another step. Next, you will go to navigation. Under demographics, scroll down till you find patient-provider relationship and complete this template by adding all the providers that the patient sees as specialists. At this point, the nurse's intake is complete, and please generate your nurse intake note.